Did you know that proper use of clinical practice guideline can prevent potential crisis in your claims processing? Doctors and hospitals go about it the wrong way. By the end of this video, you will discover the importance of clinical practice guideline in preventing problems in hospital claims processing. CPG, or the Clinical Practice Guideline, is a document with the aim of guiding decisions and criteria regarding diagnosis, management, and treatment of patients. It is intended to optimize patient care that is informed by a systematic review of evidence and an assessment of the benefits and the harm. So in my experience, clinical practice guidelines are commonly neglected by level 1, level 2, or even level 3 training hospitals. Everybody knows the CPG of illnesses of their own field of expertise. It is so common that doctors take it for granted. As a result, many of the issues in Philhealth prepayment review, post-audit, as well as Philhealth legal can be traced back to the clinical practice guideline. So, the benefits of the clinical practice guideline in claims processing are the following. Number 1, clinical practice guideline prevents claims denied due to non-compliance with the standard of care. So the clinical practice guideline are synonymous with standard of care. The standard of care is equal to Philhealth quality policies of 2016. So this covers circular number 1. It's all about AGE moderate dehydration. Circular number 2 is all about UTI. Circular number 3 is all about the CAP-MR. And circular number 4 is all about asthma. And you have circular 13 of 2018. This is all about sepsis. Non-compliance is failure to show proof of admissibility and proof of proper clinical management. Take note, I did not say you are admitting patients arbitrarily. I did not say your management is incorrect or it sucks. I use the term failure to show proof. If your hospital is serious in clinical practice guideline implementation and monitoring, the following may happen. So, all admissions will have a good history and physical exam because your admitting doctor will focus on the reasons of admission as defined in the CPG. All will be based on the standard of care. Now, there will be no upcasing or underutilization because the doctor's management will be aligned with the signs and symptoms and the final diagnosis. These are defined in the CPG, all within the standards of care. So, number 2 is clinical practice guideline as the best justification in Philhealth legal. So, let us say your claims are referred to Philhealth legal due to upcasing of diagnosis. Now, Philhealth legal office will ask you to justify or provide explanation on alleged issues of your clinical management. So if your hospital strictly implements and strictly monitors the use of clinical practice guidelines, your doctors can easily provide evidence-based clinical justification. Your doctors can easily defend their actions because it was based on clinical standards. So this means patients were given quality care. Proper laboratory or diagnostic procedures were done. Proper drugs and medicines were given. All necessary medical interventions were given. Now, all of these are aligned with the clinical practice guideline. If your justifications are anchored on clinical practice guideline, Philhealth Legal has no choice but to dismiss the complaint. So, the last is clinical practice guideline will define hospital packages. So, clinical practice guidelines or the CPG contains recommendations, strategies, or information that will assist the doctor in making decisions about appropriate medical intervention. The CPG will give you a general overview on what specific tests or diagnostics are needed. The CPG will give you an idea of the quantity and the type of medicines needed. The CPG will give you an idea on what type of care and the number of personnel needed to provide the services. The CPG will give you an idea of the average length of stay required by the patient. Now, let us link them all together. You will have the tests, you will have the medicines, the type of care, the personnel, and as well as the length of stay. Now, this will give you an estimated cost of care per patient. Now, hospitals can easily plan the purchase of supplies once the cost of care per patient is defined. Then, you may set the desired profit margin. Now, your hospital package is defined, your potential spending is defined, your profit margin is also defined. Best of all, if costing or packages are defined, your hospital will have fewer problems in the implementation of diagnosis-related groupings or the DRG in the next few months or probably year. So, as you can see, the clinical practice guideline or the CPG is critical in hospital clinical management. The clinical practice guideline is critical in Philhealth legal management. The clinical practice guideline is critical in hospital financial management. Now, these are just a few of the many advantages of implementing and monitoring the clinical practice guidelines in claims processing. So, my friends, in the next video, Philhealth as a valued client is related to this topic. So, this is Coach Doc Ben. I'll see you in the next session.